my first rotation in nursing school was on the psychiatric unit at Columbia Presbyterian. And I remember we had a big meeting before we got on the unit, and they were kind of telling us what to expect. But you never really know until you get on a locked inpatient unit what it's like. And I remember they were assigning patients to us, and there was an elderly, a senior behavioral health patient on the unit, and she was wearing sunglasses with one lens popped out, and she was clutching her bag. And they said, "You're going to sit with her today, and be careful, she scratches." And I thought, oh my gosh, I love it. In psychiatric mental health nursing, what's drawn me to that is the human story and the human connection that we have with our patients. I've always kind of glazed over when you talk lab values or procedures to me, but if you tell me a person's story, I'm in. I'm drawn in. I'm interested, and human behavior and thought processes, and and family histories, and everything that takes us to where we are now and influences the decisions that we make and the way that we operate in our world has always been fascinating to me. It's challenging both for the patient, in that they feel that others don't understand their pain or it's not tangible to them. And then on the provider side, it's the way that you talk to people so that they feel comfortable sharing with you sometimes their darkest thoughts, sometimes things that they've never said out loud to anyone, not even themselves sometimes. I think it is getting better. Are we there? No. But I think if there's positive things that come out of the pandemic, I think we're all more aware of our emotional health now, and the need to take care of ourselves, to manage our stress levels, and to make that effort, that extra effort to reach out and to connect to people. So I think in that way, mental health has become more approachable and more acceptable for people to be able to ask for help. It's a lot about advocating for yourself in your new role, making sure that you have support as a new grad. Unfortunately, because of our broken healthcare system, it can feel like you don't have enough time with patients. And in fact, I've been told that a lot when I was in clinical practice. You spend too much time with patients. You need to get them in and out and finish your charting and move on to the next one. So what we're trying to encourage them to do is to negotiate for positions where, especially in the beginning, the first 6 months, they're allotted that extra time to spend with patients, to think through what's going on, and then to have the time and the flexibility to come up with a optimal treatment plan. It can feel very helpless and hopeless when you feel like people are shuttling in and out and in and out, and you're just seeing the tips of these icebergs. And you're offering these medications, but you know that holistically there's so much more that needs to be done. So so we're talking to them about making sure that you find jobs where you're going to be supported, you have access, people are going to give you the time that you need, and to remember to take care of yourself. You can't help others if you don't have a full cup. So to make sure that they're not put in situations where where they don't feel successful.